You guys are all 20 minutes early.
Yeah.
What's up with that? Somebody gave me wrong information. Where's well you? They're not here. I won't blame them. Oh, no, it's not you. No, it's my office. They gave me wrong information. So this is going to be part one of the EAP Supervisor Series. I'm going to be talking to you for 50 minutes, which we will finish in 50 minutes. This talk, like I said, is part one of, it looks like 5. And I'm basically going to be introducing the EAP services to you as employees and to you as supervisors. I assume you're all supervisors in here? Okay, so like I said, I'm going to be introducing EAP to you as an employee, that you can use the service and how you can benefit from it, and as a supervisor, meaning how can you use EAP in supervision. We're going to be talking about your ability to recognize employees who might have problems or issues impacting their work and what to do when that happens. We'll talk about your role as a supervisor, focusing on your role as a supervisor versus your employees' counselors. How many of you are your employees' therapists? At times? Well, somebody raised their hand, actually. she's more than willing to admit that. Yeah, so you've probably played that dual role many times, and it can certainly confuse things in the workplace. And so we'll talk about whether or not that's a great idea, whether there's sort of a way that you can adjust that a little bit, and certainly how you can use us as well. So let's just jump right into this, and if I stutter around a little bit, it's because I had no time to get ready for this. All right. So basically, the first part of this is going to be an EAP overview. We're gonna re-educate you on what the Employee Assistance Program is. See, I'm not the only one who's late. I'll reintroduce to you what the EAP program is, hopefully tell you everything that we can do for you, and of course how to access us. So I probably won't follow along with this, but EAP is basically a collection of mental health counselors with lots and lots of years of experience in the mental health and addiction counseling field. And we're available to you for free because of your employment here. It doesn't matter what the level of employment is, full-time, part-time, per diem, household member of an employee, all right, which doesn't impact you guys because you're all here, but household members of your home can utilize EAP as well. We offer, it says there, expert assessment and evaluation. You guys get 5 visits per year with us, okay, per calendar year. That's not per person per household. It's just 5 visits for the entire household, right? But there's ways around that. I'll talk about that later. 5 visits in the mental health world is not a long time. So on our first visit, we're going to provide an assessment for you. We're going to help you, you're going to help me determine what's going on with you, what brought you to EAP. And if your issue is something that we can address effectively within that 5 visits, then you stay with us. If you're comfortable with us, you stay with us, we'll help you work through it. A lot of times folks come to us with a problem or an issue that's bigger than EAP. And what I mean by that is 5 visits just isn't going to do it justice. We might not be able to get to the root of the issue within 5 visits. Or if you're looking for something specific, like a psychological evaluation, right? Like drug and alcohol treatment, like psychiatry, like medication, we're not going to be able to provide that for you. So within that first assessment visit, we're going to figure out if we can help. And if we can't, if you're gonna need longer term care, I'm gonna want to get you connected with somebody on the outside sooner than later. So you might come to me for 1 visit, and I might refer you out to a private therapist, to a psychiatrist, to a psychologist, to some other resource in the community, because I don't want to see you for 5 visits and then give you to somebody else, right? That's usually pretty ineffective. You're going to talk with me, you're going to disclose some stuff, you're going to feel comfortable with me, and then I'm going to give you away. I don't want to do that. So if I know that's going to happen, if we decide that's going to happen, I'm going to try to get you connected sooner than later. Okay? And I'll refer you to somebody who takes your insurance, somebody in the community, somebody who specializes in the area of need that you're looking for help in. So we offer short-term therapeutic approaches to resolve workplace and personal issues. 5 visits per year. We said that renews annually. I always tell folks that now is a good time of year to have problems because we're coming towards the end of the year, right? And we'll just start to transition into a new year, so you can get 10 from us, right? So I always tell people, like, April, May, tell your problems to kind of hold off until October, November. We'll get you in for 10. We offer 24-hour crisis coverage. So basically that means, A, we're on call to you 24/7, okay? If you've got a problem, it's Sunday at 2 o'clock in the morning and you're in crisis and you need to talk to somebody, you will call us if you'd like. You'll call our number, they'll get our answering service. That answering service will reach out to one of us that's on call, and we'll call you Sunday at 2 o'clock in the morning and talk about whatever's going on with you. Okay? Feel free to do that this month. I'm not on call. When I'm on call, I prefer to wait till after breakfast to have problems, but I'm available to you 24/7. We also offer what's called on-site critical incident stress response. Hopefully I never get to interact with any of you regarding that. Basically, critical incident stress management means if something out of the ordinary happens here that impacts you as an individual or impacts you as a department or as a giant organization, we're going to be available to you to come out and process and to debrief. And usually that involves something pretty traumatic. Unfortunately, I've come here for employee death, for coworker deaths, for major illness or a death within a coworker's family that impacts a unit. That's happened. Sometimes, and it's strange to say because we're a hospital, but sometimes we'll come here for patient deaths. All right. Sometimes it's a unit or a department that is not used to death, and you have somebody die in your unit. We'll come to you. Sometimes there's a patient that's been here for so long and they've made an impact on the department and and they die, and you guys are human, and so you're upset. We'll come and help you work through that as well. Okay. So usually it's a big event. Like when you watch a story on the news and, it says grief counselors are on site. That's something that we'll be able to provide for you. Okay. And if you guys have questions about, just jump in. Noon Hour Health Bite is something that we offer monthly. So basically we're going to go and pull somebody from the outside, a speaker on a particular topic, and we're going to bring them here and they're going to present to you from noon to 1. And it's a range of topics. It could be mental health related, it could be anxiety, it could be addiction, it could be gardening, it could be protecting your kids from the internet, it could be exercise and yoga, it could be all those things. So any kind of wellness topic. So we do that every month. Check it out on our website and through our newsletter. You can see what topics we're offering. And those are streamed as well. If you can't get to the location where they're at, they're streamed and they're put on they're archived. So you can go back and watch old ones as well. Okay. Monthly newsletter. Hopefully all of you guys are getting that. If you're not, reach out to us and we'll get it to you. And our website is full of information. You can meet the counselors on our website. You can see our pictures and our profiles and our backgrounds, and you can see past presentations. This might be put up there. This series will be probably put up there. So lots of information that you can gain from our website. Also, topics on presentations that we'll come out and do for you. I do a lot of talking on compassion fatigue, on burnout, on stress management. We do a guided relaxation with WellU every month. So check out what we offer. I'll try to fly through this. Basically, whatever's going, I tell people, if you got something personal or professional going on in your life and you feel like you could benefit from talking about it, then that's a good reason to come see EAP. Right? We'll try to put some things up there. We'll try to give you some ideas or reasons why people would come to see it, but it's kind of ongoing and infinite. So these are some common things folks come see us for, depression, anxiety, work or personal related stress, issues with a supervisor, issues with a coworker, just issues on the job in general, grief, loss, family, relationship issues. We'll do couples counseling at EAP, child-parent problems. We'll see your kids at EAP. Addictions, I'm kind of the addictions guy at EAP, so you'll probably see me if there's something going on with you or your family in the addiction world. Of course, we're not treating addiction at EAP, so most likely you'd be looking at a referral. A lot of times folks come to us and they don't know where to go. They don't know who to call. They've got a family member who's going through some stuff, and so they'll come talk to me about, what is this stuff that my family member is going through? How do I deal with this? How do I get them help if they're ready to do that? So stress-related illness, financial problems. There's sometimes folks hear financial problems, or they see it in our brochure, and their employee comes to them, and the employee says, I can't make my rent this month. And the supervisor goes, call EAP. They'll help you. We don't have any money. We don't have a vault and crack the code and here's $500. We don't have that. So basically, when we say financial problems, we can help connect people with credit counseling. We've linked up with a credit counseling agency. If you're going through a foreclosure and you don't know where to turn to, we can help you connect with some legal representation. And sometimes it's about coming in and sitting down and verbalizing the stress and the anxiety associated with the financial problems. We'll help you create a budget if that's something that you want to do, but we don't have actual financial support for folks. Things like downsizing, change. There's a lot of change within the university at all times, so that can be stressful and anxiety producing. Eating disorders, again, we probably farm that out. Sometimes people don't need counseling necessarily. They just need some resources. They don't know where to turn. They have some issues and they don't know who to contact. So call us anyway. Call us if you don't need counseling. Call us if you have questions about child care issues. What do I do? Who do I turn to? Elder care, that's kind of a growing area of concern. Who can I reach out to for this issue? And location and community resources. Part of our job, most of our job, is to connect you with outside resources. So we make it a point to be well aware of the resources in the community. Not just therapists and psychologists and psychiatrists, but all sorts of other resources that you might need. Our staff, like I said, all master's level clinicians, lots and lots of years of experience. Pretty much most of us have private practices in the community. We've been doing this a long time. I'm kind of the rookie with 13 years of experience, so we've been at this a while. The role of health insurance, well, there isn't one. It doesn't matter if you have health insurance. You get visits to EAP just because you're employed here. So if somebody else carries your health insurance, that's fine. We'll never even ask you about health insurance. You guys can finish this sentence. What happens at EAP stays at EAP. Right. Okay. So confidentiality, right? We both work for the same big place. Why would you want to come talk to me about work or personal stuff, addiction, domestic issues? Why would you want to come talk to me about that stuff if any of that stuff was going to get reported back to your employer? All right, you wouldn't want to do that, and we wouldn't exist. There would be no EAP. So I can assure you that regardless of what you come to see me for, and this is important when it comes time to talk about the supervisor portion of this, regardless of what you come to see me for, nobody finds out you came to see me. I don't report to anybody. I don't call your supervisor. I don't call HR. Nobody. Nobody can call and ask for notes. Nobody can call and ask if you showed up, if somebody suggested that you come to see me. So when you guys are making the soft referral to EAP, if you're telling your employee about it, you can't call me and ask, did they show up? Because U of R is not an organization that mandates the EAP. We'll get into all that. I had something else I was going to say on that one. Confidentiality. All right, it'll come back to me. Oh, I told you. This e-record thing you guys use, I heard it's fairly easy to navigate. I've never used it. I've never seen e-record. We don't have e-record at EAP. We have no access to it, which means that your notes are not going into e-record. They're going into a system that we purchased that's exclusive to us that nobody has access to. And we're not a mental health clinic. We're not funded by, Office of Mental Health. So we're not diagnosing you at EAP. We don't have to keep detailed clinical notes on you. And like I said, they're not an e-record. So nobody has access. It's not part of the Your Chart system. It's private. Because U of R is one of our clients. We have 60 other companies that utilize EAP, our EAP. Some big ones, Monroe County. All Monroe County employees come to us for EAP. And that includes sheriffs. We have RPD. We've been with RPD for 30 years. We have the Rochester Fire Department. We've got, East House. We've got DePaul. We've got the ARC. We've got, lots of companies like that utilize strong EAP. Okay, and they're certainly, we're not putting their notes into e-record, right? Okay. Questions so far? No? Good. Eligibility, like I said, you or anybody in your household, doesn't have to be a family member. If somebody non-related is living with you, they have access to EAP as well. When you come to see me, you're fully informed of confidentiality. If you want any information released, you have to sign a consent, and that consent is pretty detailed about what information you want released. Okay? Nobody really ever does that, so we're not. If for some reason you need information released, you'll be signing a consent form. So the privacy and HIPAA acts that are pretty much standard across the boards apply to us as well. This is how you find us. We're 496 White Spruce Boulevard, right across from MCC. Regular business hours 8 to 5. Wednesdays and Thursdays we're open until 7. Okay, so if you need an evening appointment, Wednesdays and Thursdays will accommodate you. Basically, we're going to accommodate any way we can. So if you need a 7 o'clock appointment in the morning, if you need a 7:30, we'll make sure somebody's there to see you at 7:30 in the morning. We don't do weekends. And if you happen to live, out west, Hilton, Brockport area, we got an office at Strong West. I can meet you out there. We can do a phone session if you can't get to me. I know you guys park here, or you park like 3 counties over, and you take a train here. And, so you can't get to me for whatever reason. We'll do a phone session. Okay. And if you're if you really want to, test technology, we're doing this telehealth thing, almost like Skype. We're doing it through this program called Zoom, so we can meet over Zoom if you'd like. Okay. So lots of ways to see this. All right. So that's that's to educate you guys on EAP. You can pass this information, of course, on to your team. If you have a particular unit that you can gather up everybody and you want me to come out and do the first half of this, a little bit longer, more detailed, for your employees, I can do that as well. But it's also for you guys, because you guys are employees as well. So how EAP benefits you as a supervisor. We want you to consider us an alternative to tolerating poor performance or taking adverse action. All right, adverse action meaning termination in most cases. We want you to consider us in the middle of that. You no longer have to just deal with the behavior, and you no longer have to just terminate. EAP can be considered an option as well. We want to try to eliminate your need to get overly involved in the personal problems of the employee. And we'll talk about why. If we're involved in the personal problems of the employee, then that allows you guys to focus on performance and not let personal issues get in the way of what you're focusing on. And we can offer supervision tips. We can be used as a, you can reach out to us anytime you need. I'm not a supervisor. I don't pretend to know more about supervision than you do, but you could call us. You could call us and ask some questions. You could call us and just, check in with us if you have specific questions. Consulting. Hey, look at that. You can consult. You can use us as a consultant, right? If you don't need to come see us, if you don't, we're not mandating your employees to us, but you still have access to us as a consultant. Just reach out if there's something particular going on. And of course, education and training will come out. We'll do presentations for your staff, effective communication, coping with difficult people, stress management, compassion fatigue, preventing burnout. You might be able to benefit from having your staff gathered up and having one of us talk about one of those topics. So this portion, again, we're kind of flying through it, but this section is basically a reminder of what to look for in an employee, which, behaviors that might indicate a troubled employee. Okay. But first, we'll talk about reasons that we've heard why supervisors don't refer to EAP. And again, when we're talking about the U of R, we're talking about a soft referral. All right, a soft referral is, because we had an EAP. I think you might be able to benefit from talking to somebody. Here's their brochure. Here's their card. I think you should consider reaching out to them. That's a soft referral. That's basically where U of R stands. Other companies that we have can mandate the EAP, where it's part of the disciplinary process, something's going on professionally, behaviorally, they're mandated to EAP, they have to show up. U of R doesn't do that. So when we're talking about referrals, we're talking about soft referrals. So some reasons why folks don't refer to us, the employee is getting help someplace else. That may or may not be true. His or her career will be harmed. That might be true without confidentiality, all right? But with confidentiality, nobody's getting harmed by coming to EAP. We're friends, we socialize, we drink together. Okay, that's a good reason not to refer to EAP, I suppose. But the whole idea of this would be to try to separate, the social aspect of your relationship with your employees versus the work aspect. The employee will be offended, maybe. I don't know, they might. If I refer, it will only delay termination. That's not true. We're not part of HR. We're not connected with HR in any way. We don't have anything to do with whether or not you're going to terminate an employee. So referring to EAP won't delay that at all. It might save the employee if they come back and they've improved, but it won't delay anything. Supervisors would fear that the EAP will see our work unit's dirty laundry. Maybe. If an employee does come to us and they've got, because another page over is they're going to tell EAP about me. They're going to talk about me as a supervisor, and I can tell you that they will. That's just how it goes. If they're referred to EAP or if they come on their own and they've got a work-related issue, they're most likely going to tell me all about you. But what you have to realize is that our role is not to judge you. Our role is not to, tell the employee. We would never be, by any means, tell the employee that you're wrong. All right, that there must be something wrong with your supervisor to treat you this way. We would never do that. Our role is to help that person work through whatever is going on with them to get them to be more effective as an employee. All right, so if they came to me and were unwilling to take any responsibility for anything and it was all your fault, I would try to help them figure out a way to cope with everything being your fault. Okay? How well are you going to quit? No, I'm not going to quit. All right, then how can we get you to coexist with your supervisor? How can you not let their faults bother you? It wouldn't be about you. But they will tell me about you, I promise. I've heard about every one of you, actually. We're focusing on what they can change, okay, not what you can change. Referring would show that I can't fix problems. I don't think you're supposed to fix problems. I feared the EAP would learn I was protecting the employee for so long. Again, not something that we're necessarily interested in. We're interested in the employee helping themselves. I believe the problem was a temporary thing. The problem is not bad enough for the EAP. We would kind of like you to send them to us before it's bad enough. Use it as something preventative. Everybody could benefit from sitting down and talking with somebody, especially if you're running a very intense unit, if there's, constant trauma or, everybody could use a check-in. So there is no problem that's not bad enough yet for us. The employee will tell EAP about me. I already said they will. The employee will be stigmatized. Again, without confidentiality, maybe they would be, but that's not an issue because of confidentiality. And I feared the employee's emotional reaction. It's kind of our job to deal with their emotional reaction. You're just making a suggestion. So remember, EAP is here to assist you, the company, and the employee. Okay, we play a dual role. So we want to help the employee deal with whatever issue is going on with them that might be contributing to the work issues, and we want to help you guys, create a positive work environment, a healthy work environment. An employee coming to us doesn't reflect badly on anybody. Again, confidentiality plays a huge role in this. Avoiding the referral or avoiding talking to an employee most likely is just harboring the issue, which is going to grow and grow and grow and most likely impact you way worse later down the road. All right, so what is a troubled employee? It says an employee whose personal problems adversely affect job performance. Okay, typically 12 to 18% of employees in an organization experience personal problems that interfere with the job performance to some degree. We all have been troubled employees at some point in time. All of us at some point in time have allowed our personal problems to interfere with our day. All of us, to some degree or another. But the continued negative impact that a person's personal problems has on work needs to be taken a look at. So a troubled employee would be an employee that has, very consistent adverse reactions, consistently bringing their work stuff or their home stuff to work, consistently having their productivity impacted, their attendance, their behavior. A troubled employee are those with performance problems that continue despite reasonable management attempts to correct them. All right, so somebody who's not getting any better, somebody who consistently brings their stuff to work. The ideal situation, of course, is that we'd be able to leave home at home, right? Leave work at work, that work-life balance thing. But again, that's not always reasonable. Like I said, we've all brought our personal problems to work at some point in our careers. So folks who have minimal coping strategies, folks who feel completely overwhelmed by their problems, really won't be able to keep it out of work for too long. There might be some who could keep it outside the door, but as those personal problems build up, as the severity of those problems build up, it's most likely going to come with them. Not everyone can shut off personal problems when they walk through the door. Again, especially if some of those personal problems are very serious. Here's some serious examples. Not everybody can turn off, family discord, marriage issues, big fight before work with your spouse. Kind of hard to turn that off when you walk through the door. Illness, your own illness, family member's illness, death, financial issues, addiction, childcare, anxiety, depression, other mental health issues. A lot of times they're not checking that stuff at the door. It's coming through with them. Now, how many of you, again, you raised your hand, but and I want you to let yourselves off the hook here. It's common, but how many of you have played the role of counselor with your employees? Yeah, and the rest of you are lying. We've played, and I can't pretend that that's not normal. I'm not going to tell you to not do that. That's unrealistic. Of course, at times, you're going to play that role with your employee. They're going to come to you. They're going to have an issue. They're going to close the door. They're going to say, can we talk? And you're going to say, what's up? And the tears and the Kleenex, and it's going to be that whole thing. That's normal. That happens. What we want to talk about is how frequently is that happening and how deep are you getting? How involved are you getting with this person's issues? Okay. Because eventually, if you continue to be that comforting, friendly voice, they're going to start relying on you to be that comforting, friendly voice. You're going to be the person that they can go to. And that might start confusing the relationship a little bit. Okay? And I always use the analogy, and people are like, oh. But has anybody ever fed a stray cat? What happens when you do that?
They come back.
They come back. They live with you now. Right? So, because when they were their most vulnerable, you took care of them. Right? So when your employees are at their most vulnerable and they come to you and you take care of them, that might lead to them coming to you more often, again, which will confuse the role. You might elicit unrealistic and inappropriate promises because of their state. Somebody's completely losing it in your office and you feel the need to take on their stuff, you might say some stuff that you can't deliver. Or you might have them say some stuff that they can't deliver. Because they, somewhere in their head, realize that they're communicating with their supervisor. So they might tell you that they're going to make some changes that they might not be able to deliver. This has come up a few times. The first normal reaction when an employee comes to you completely upset, in tears, not in control of their emotions, the first thing to do with them is what? You can say it. Send them home. Why don't you go home? Take the day off. And in a lot of cases, that's perfectly fine. But in some, it's not. We don't want anybody sending anybody home if they don't appear to be in control of their emotions. If they're not in control of their behaviors. They're not doing well. And when I talk about consulting, you guys can reach out to us only because this has happened before. Where folks have called us and they say, I don't know what to do. I've got somebody in my office, they're freaking out, they're upset, they're saying stuff, they're talking about suicide. I don't know what to do. And that's a perfect job, a perfect reaction on your part is to reach out to us. Because we'll help you navigate that. You're not supposed to know what to do. Right? We don't expect you to be in that role. Right? So come to us. If something's going on, come to us, and we'll be able to either talk to the employee and maybe give them sort of an assessment over the phone to find out what's going on. We'll check lethality with them. We might get them to us, right? We have crisis appointments every day. One spot every day that we leave unfilled in case of crisis. So if somebody's in your office and they're melting down and they're in crisis, there's a pretty good chance that you can get them in to see us that day. And then we would talk with them and determine whether or not they could get to us safely. Can we have somebody bring them to us? I'll come here if needed. But if the problem is severe, and again, this has happened, and hopefully none of you experience this, and maybe none of you have or ever will, but there's been times when a supervisor or HR has reached out to us and said, I've got an employee that is suicidal. Either somebody's seen something on Facebook from the night before and they tipped off somebody, or the supervisors, they confessed it to them. What do I do? In that case, again, reach out to us, let us help you. All right, there's things that can be done to assure that employee safety. And most likely, if that was the case, what we would do is we'd reach out to either mobile crisis or CPEP here. And they'd come here and they would assess or evaluate that person. And if they were determined to be at risk, then we'd go from there. There'd be some hospitalization involved, but that's a pretty extreme thing. It's not pretty, it's not something nice that you want to go through, but there are things that we can help you with. There are things that can be done here. And when we talk about sending an employee home, we're going to get into some signs and some substance abuse as well. Obviously, we never want to send anybody home who you think is under the influence. And again, I hope that never happens to you, but I wouldn't be talking about it if it didn't happen. It has happened, of course. So you never want to send anybody home who you consider to be intoxicated from the night before maybe, or who appears to be under the influence of another substance. So again, we're in the next hopefully 15 minutes. I'll give you some things to look for. I'll remind you of some things to be aware of when it comes to employee performance and behavior. You just want to be alert to decline or changes in job performance, especially with those who have histories of good performance. You are well within your supervisory right to ask them what is causing the problem. What's causing this performance issue? Of course, that's your right. If it's personal, just like we talked about a minute ago, I would remind them that we have an EAP, where you can go and confidentially discuss these personal issues. You don't want, it says don't discuss the problem, that's not realistic. I think most of you are going to get into some kind of discussion about the problem. You determine how deep you want to go, and then remind them about EAP. If it's not personal, then do your supervisor thing. Address the relevant workplace issues. So again, some things to look for. That the pathetic-looking person there, she looks sad. I don't know what's going on with them. But here are some just things, some red flags to be aware of. Somebody who's absent without leave, somebody who's absent from the work site without a good reason, excessive sick leave, absent Mondays, Fridays, after holidays, or the day after payday. Why is that up there? Drinking? Maybe. Yeah. Sure. Absent Mondays, that means we had a long weekend. Absent Fridays, that means we're about to have a long weekend. After holidays, self-explanatory, and payday, of course. Repeated absences for longer periods of time. Elaborate and increasingly improbable reasons for absences. Why would that happen? Think about that. Why would a person need to use these elaborate, improbable reasons?
They've used up the other ones.
They've used up the normal ones. Yeah. Right. The standard reasons for absence, we've already played all those cards. So now we got to get crazy. Now we got to go improbable. Early departure from work, excessive tardiness, long lunch hours, or not just coming back from lunch, that's a red flag. Unexpected absences of 2 to 4 days or longer. Family members and others calling in sick for the employee. Why is that a red flag? Oh, this has happened? I'm not just making this stuff up. Why is that a concern? The person's incapable. How many of us have been really, really, really sick? And how many of you have been able to, none of you have been really sick? One person. How many of you have actually been able to call in sick to work? All of you. As sick as we've been. No? Oh, stop, you're messing this up. For the most part, most of us, if we've been really sick, we've been able to call in sick to work. Okay? In extreme cases, we've had somebody call in work. But most of us are able to call. We're not able to call if we're not awake. All right, if we're inebriated. We're also not able to call if we're not home. Okay, and that's happened as well, especially if we're dealing with some severe mental health stuff or some severe addiction stuff. There's a good chance we're just not home, and our loved one is either covering for us or we've convinced them to cover for us. Take a look at changes in quality of work. Missed deadlines, errors due to inattention, poor judgment. Fluctuating work pace, alternating between periods of high and low productivity, short periods of good performance after corrective interviews. We tell people that if there's something severe going on in a person's life, and you guys call them out on it, and potentially scare them, you make them aware of the issue, you talk about consequences, that person is going to go on a short burst of good work. They're going to go on a short burst of improvement. Okay, because they're kind of running on adrenaline now at this point. They're running scared. But what's going to happen is the severity of those mental health or addiction issues are going to override eventually. So they might have a little burst of good performance, but that stuff is going to creep up eventually and overtake it. Okay, so if you see fluctuating performance issues, that could be a red flag. Lapses of attention, inability to concentrate, complaints from people outside the unit. We talked about elaborate and improbable alibis, confusion, increasing difficulty handling assignments. blaming others for job performance, exaggerated work accomplishments, and inappropriate requests for recognition of average performance. So that's a red flag because, you know, a person is probably failing in other areas of work that they're seeking out some kind. They want to remind you that they're a good employee still because they were on time 5 days this week, and they'd like some feedback for that. You know, or you know, I finished this deadline on time. You know, I should get. That's great. You know, that's your job. So they're probably used to hearing negative stuff from you. They're probably well aware that they're failing in other areas that they want to, that they're searching for positive and inappropriate feedback. Refusal to follow instructions, belligerent, complaints of being treated unfairly, overreaction to real or imagined criticism, inability to hear or accept feedback, undependable statements, lying, you know, kind of. So again, things that individually, all right, on their own might just be a person having a bad day. All right, so we don't want to overreact. You know, we don't want to freak out and think our employees are, you know, because some of these things are going to happen every once in a while. But we're talking about a collection of these things consistently without improvement over a period of time. So some others, you know, borrowing money from coworkers, that's happened before. Loss of ethical values, you know, tampering with time cards, use of computer. Deterioration of personal hygiene. Why is that up there? Everybody kind of giggles at that and gets uncomfortable with it, but
Somebody stops there.
yeah, it's actually one of the #1 signals or symptoms of a mental health or addiction issue is deterioration in personal hygiene. So you have, you know, a person who just has other stuff going on and is giving up or you know, putting in less care. Maybe the person, again, didn't go home last night, and so this is the best they can do to get to work the next day. So pay attention to that stuff, even if it seems kind of, you know, it seems we're picking on something small, it's actually huge. Mood swings, mood changes, complaints of not feeling well. Claims of getting help for personal problems without improved performance. Again, this could, you could experience this if you get too close, if you get in too much, because that person, again, knows that you are in charge of their career for the most part. So they might make promises to you that they are getting help. I'll take care of this, I promise. Let me handle this. And you don't see improvement. Okay. Drinking on the job, that's typically a red flag. What's the, it's up there, but what's the #1, how could you determine alcohol? What's the best way to determine whether or not somebody's been drinking? Yeah, smell. That's it, that's the number. So you guys don't know it when you're drinking, but I know it when you're standing next to me. 1 glass of wine, I will be able to smell 1 glass of wine on you. You don't smell it, but I can. So somebody who's been drinking the night before, we've had this happen a lot. You know, somebody will come to work and they'll say, I haven't drank since last night. Well, last night might have ended at 4 a.m., right? And they got 3 hours of sleep and they came to work. They're still intoxicated. There's a pretty good chance that they're going to have a BAC, you know, above the limit. And you'll be able to smell that. And if you're meeting with them and you suspect it a little bit, but you're not sure and I can't really detect it, when you guys leave the office, you come back in the office and you'll smell it. Okay? #1 way of detecting alcohol. All right. I don't know. I'll pick and choose what we're going to go through here. We've only got a few minutes. As supervisors, your #1 thing to do is to make sure you're documenting performance. The idea here is to get the employee the help they need, but you still have a job to do as a supervisor. So even if you're attempting to get the employee some help, you should still be properly documenting poor performance. You'll document discussions, encounters, actions, or steps taken, verbal warnings, or conferences held with the employee. These next 2 slides are do's and don'ts of documenting. We'll skip that. Make documentation open and available. Pass documentation on to future supervisors. These we'll skip through. Actually, no, we won't. We'll close with this. Here's an example of some documentation. The employee was extremely late and obviously appeared hungover. She acted inappropriate when she was confronted and said that other employees come in later than her. The employee stormed out of the room and observers were stunned by the behavior. 2 employees report that domestic problems caused her tardiness. Is there anything wrong with that? No, that's a good one. Where do we start?
Hungover.
Subjective language, hungover, extremely late. What does extremely late mean? Extremely late to you might be, kind of on time to me, right? So what, we'll get into the actual, let's look at the good example. The employee was late today. We're going to identify date and time. She appeared to be out of proper uniform. When confronted, the employee became belligerent, stating, and then you're going to put some statements in. She interrupted while being corrected and appeared unwilling to accept feedback, stating, and we'll add some statements. She left the room slamming doors. The noise was loud enough to be heard by others who came to investigate. 2 employees reported feeling fearful of this worker's behavior in stating. Okay, so we're not using words like hungover. We're not saying things like extremely late, which can be defined differently by everybody. We're putting in some good facts and some good language there. Okay, so how do you refer to us? There's one way. Again, suggestion. If you have an employee who you think is going through some stuff, you can remind them what EAP is. You can give them our card. You can give them our brochures. You can remind them of the confidentiality. You can tell them that you, as their supervisor, will never know if they came to see us or not. That you, as a supervisor, cannot call us and say, hey, I suggested so-and-so come. Can you at least tell me if they showed up or not? We cannot tell you that. And you can reiterate that to the employee. Okay? I'm never going to know if you went or not. They won't tell me. Like I said, U of R does not mandate employees. It's just that we don't do that. So again, we're only talking about a suggestion, a soft referral, and I would just make yourself very familiar with our services and have brochures. And if you need brochures, call us, and we'll send you over a big box of brochures. If you want to hang a poster up in your office, we have EAP posters. You shouldn't be without our business card. If you need our business cards, we'll get them to you. Okay. Any questions? Not a single question. We have 2 minutes left for questions.
All right.
Yes, good.
So how do we know whether we should come to you or go to HR? So if there's performance issues, my first reaction would be to call my HR business partner.
Sure. And I would, and I think Peg's here. I would, for performance issues, I would keep it in-house. I would deal with performance stuff, and I'll ask Peg to do that again, or to talk more about that. But if the performance stuff, if you've investigated a little bit, or you know this person really well, and you think there's a behavioral issue going on that's impacting the performance, I guess you could do both. As the supervisory responsibilities, you could reach out to HR, you could do your documentation thing, but you could also say, I would like you to, consider talking to these guys. Okay? And I always tell people, for our mandated folks, for our non-mandated folks, if somebody suggested they come to EAP, it's actually a good thing because it means you want to keep them. You don't have to keep them, right? If you want that employee and you want to figure out what's going on with them and you want to help them improve, I tell them being sent here or asked to come here is a positive thing. It means your organization wants to work with you. Is that about right, Peg?
I agree, absolutely. If you're supporting the individual in whatever he or she may be going through.
Okay, good. 1 minute for questions. None. Okay. If you guys need cards, brochures, posters, let me know. We'll send a package over to you, by the end of the week. Okay?
Thank you.
Thanks for your time.